Good afternoon, and thank you all for coming. I am Dr. Ngozi Ezike, the Director of the Illinois Department of Public Health, and I'm pleased to be joined by Dr. Allison Arwady, Commissioner of the Chicago Department of Public Health, and Dr. Terry Mason, Chief Operating Officer at Cook County Department of Public Health. Today, the CDC, the Illinois Department of Public Health, Cook County Department of Public Health, and the Chicago Department of Health are confirming the second case of novel coronavirus here in Illinois. I want to start by saying that the risk to the general public remains low. The second case is a Chicago man and is the husband of the first confirmed case in Illinois, a woman in her 60s who returned from Wuhan, China on January 13th. This second case did not travel to China, making this the first person-to-person transmission of the novel coronavirus in the United States. We have been closely monitoring individuals who had close contact with her, including her husband, for illness. He recently began reporting symptoms and was admitted to the hospital and placed in an isolation as visited in the last 2 weeks, and any close contacts who were possibly exposed. Professionals are taking a cautious approach in identifying and actively monitoring individuals, such as healthcare workers who may have been in contact with either of the confirmed cases in an effort to reduce the risk of additional secondary transmission. Currently in Illinois, there are 21 individuals who are considered persons under investigation. We could see more cases among, and I want to reassure the public, we are actively monitoring these individuals and implementing transmission precautions to minimize the risk of spread. Again, the risk to the general public in Illinois remains low. This person-to-person spread was between two very close contacts, a husband and wife. The virus is not spreading widely across the community at this time. We are not recommending people in the general public take additional precautions, such as canceling activities or avoiding going out of their homes. The Illinois Department of Public Health will continue to partner with the CDC, who has a team on site in Illinois. We will continue to partner with our local public health partners as we continue our aggressive response effort to minimize transmission. And with that, I will turn it over to Chicago Department of Public Health Commissioner, Dr. Allison Arwady.
Thank you, Dr. Ezike, and good morning, everyone. I'm Dr. Allison Arwady, the Commissioner at the Chicago Department of Public Health. I'm really here to provide some local context and then to be able to answer your questions. So this news today is really a continuation of the news we announced last week when we shared information about the first confirmed case in Illinois in a woman in her 60s who had recently traveled to Wuhan. That first case patient is doing well. She remains hospitalized and in isolation primarily for infection control. Our newly confirmed patient is a man in his 60s, as you heard, the husband of our first confirmed case. He is also currently hospitalized and in stable condition at this time. I recognize that this news may raise people's concern, but I want to state clearly that this development is something we have been prepared for. It is related to our first case patient, not to spread of novel coronavirus in the general public. We do not have sign of spread in the general public at this time, and there is no local emergency. We know coronaviruses are most likely to spread through close personal contact, and we know that this new patient had close contact with his wife after she began to develop symptoms. So it's not totally unexpected that he acquired the virus. This is exactly why public health has been monitoring him closely and why we monitor any close contacts of confirmed cases. Public health has tried and true ways of preventing the spread of disease. We use the same approach whether we are investigating a case of measles, of tuberculosis, or of novel coronavirus. First, we focus on education. We work quickly to educate the public and our healthcare providers about a disease, its risk factors, its symptoms, and we update that guidance to make sure that especially our health providers have the most up-to-date information. This has been going very well in the Chicago area and around the state. We have high awareness in the clinical setting locally, and I want to thank the many healthcare providers who have been reaching out to public health with questions or to discuss individuals with recent travel to China. Secondly, we focus on the clinical care of case patients. When we identify a case, we coordinate with the healthcare system to diagnose and treat the patient and to ensure the patient is in a setting where the risk of spreading infection is as low as possible. This new case patient has been admitted to the hospital. He's receiving excellent clinical care in an appropriate setting for infection control. And I want to thank again the many healthcare workers who have been working diligently to ensure excellent patient care and strong social support for this family, as well as the close attention to infection control practices. And then thirdly, we focus on limiting the spread of disease. We work in coordination with federal, state, and many local public health partners to identify close contacts of any confirmed case, as well as the healthcare workers who have helped care for any confirmed case. Since last week, we have been following on an individual level the people who had close contact with that first confirmed case, which included her husband. We have also been following the healthcare workers who have been caring for that first case. We assess these contacts, continue to follow up with each contact every day to monitor for any new symptoms. CDC believes at this time that it takes between 2 and 14 days to develop symptoms of novel coronavirus after being exposed to and infected with the virus. So if a contact does develop new symptoms within this 14-day period, we work quickly to isolate the contact and coordinate testing. This standard public health approach is the CDC recommendation, and it is how our case patient was identified. He was being actively monitored by public health to see whether he would develop symptoms, and he was being tested proactively as a very close contact to our first confirmed case. Now that his test is positive for novel coronavirus, we will ensure appropriate follow-up with his close contacts, just as we did for his wife. I want you to know that this new patient has been extremely helpful in sharing the details of his activities and contacts. We continue to gather information and clarify details, but we know already that just like his wife, he has not, for example, taken the L. He has not attended any large gatherings. So let me reiterate in closing, echoing Dr. Ezike, this news does not change risk to the general public nationally, across Illinois, or in the Chicago area. It's not a local emergency. As I've said before, we take emerging viruses very seriously. There are still many unanswered questions about this novel virus, and that's why we're pleased to have CDC on the ground really helping as part of this investigation. But I can reassure you that even with this news, the health to the general public from novel coronavirus remains low at this time. Chicago and Illinois have been building our public health preparedness systems for years. We have a solid response plan in place. There is no need for the general public to change their behavior in any way based on today's news, and we will continue to update you if we have any additional information to share. With that, I would be happy to take questions.
So when did you put in isolation, and can you confirm if you took a flight to Cleveland as recently as this week? Has he been going to work?
So I can confirm that the patient was placed into isolation on the day that he developed symptoms, in line with CDC guidance.
When was that?
That was 2 days ago.
Is isolation the same as quarantine? Is it just a matter of terminology?
Yeah, thanks for asking that question. It's a great question. So isolation actually refers to putting individuals into a setting where they are unlikely to transmit disease when they themselves may have symptoms. Quarantine actually refers to taking healthy individuals and restricting their movement in some way. So at this point, the individuals that we are talking about, you know, who the close contacts persons under investigation who might have even mild symptoms are in isolation. Some of what China is doing, where they are thinking about restricting movements of individuals who are not ill, gets closer to the quarantine side.
So you mentioned that he was already being observed because of his wife. So did he self-report his condition, or was it kind of fairly obvious?
Yeah, that's a great question, too. So what we do in public health is, first of all, work really hard to get a clear assessment of the persons who could potentially be at risk of spread for this patient. So that includes his close contacts. Certainly out of an abundance of caution, we also monitor healthcare workers. We then really work to follow these patients carefully. Every day, sometimes multiple times a day, depending on the situation, we're following up with this patient, asking very specific, well, not just this patient, with any of the close contacts, asking whether people have fever, asking whether they have any new respiratory symptoms, assessing whether there needs to be any concern for potential risk of spread. The way this patient was identified was through our standard public health procedures, and we moved to put him in isolation in the hospital, absolutely according to our protocols.
At that point, this man was being monitored because he'd been exposed to the woman who tested positive. So had his test results come back already from the CDC, or did you just find out about him because he self-reported his symptoms?
So we've been proactively testing individuals who have been in contact with the case. We received the first test result back just last night from CDC. So that's, and just for some context, and again, there can be a lot of terms here, right? We're talking patients under investigation, we're talking contacts. I want to be really clear that when we have a confirmed case, that means that we have a reported positive result from the CDC lab. And so we received that lab result last night, but the patient was already in isolation because he had developed symptoms.
You knew that his wife had been taken to his wife had been put into quarantine last week, during which the CDC was testing him. It sounds like you discovered that he was positive because he self-reported before the test results even came back from the CDC. So is it taking too long for these test results to come back?
Yeah, so I would say the CDC is obviously, as is everybody, really interested in understanding as much as we can about this virus. And so we have been doing quite a lot of testing, actually, of asymptomatic contacts, people who don't necessarily have any symptoms, to learn more about the spread of this disease. In terms of this individual, the standard public health is really to follow when a patient may develop symptoms to make sure that they're isolated. I'll remind you that the CDC at this point really is saying that the risk of spreading coronavirus from a person who does not have symptoms is considered to be low. I know there have been some reports out of China potentially reporting that. CDC has been careful to clarify that they need to have some direct access to that data, and some of that is happening. But in this setting, and what we do know about other coronaviruses, is that in MERS, in SARS, we were not seeing spread prior to the time that people had an onset of symptoms, and where we were seeing spread was among close contacts, healthcare workers, and among people who were exposed when people were symptomatic. And so these decisions, they're recommendations coming from CDC based on prior experience, and then also based on emerging knowledge every day.
That said, doctor, is it possible his results came back from the CDC after he already reported having symptoms, therefore exposing more people potentially?
So again, he was put into isolation when public health learned that he had developed symptoms. That is really considered the trigger for being a risk for spread of infection based on what is known at that time. You're correct that the test came back while he was already hospitalized.
Is it possible that the transmission was before his wife was symptomatic?
We have absolutely no reason to think that. This is let me walk you through that a minute. So the wife traveled to Wuhan, China, where we know the epicenter of the outbreak has been. She returned, she flew back to the US. She was not having symptoms at the time she flew back, I'll remind you. And then she did start to develop some low-grade symptoms over the next few days, where she was broadly, not having a lot of contacts, broadly staying home, and then went into the healthcare system. the husband had exposure to this patient at the time, to the first patient, at the time that his wife was having symptoms. And so we have absolutely no reason to think that he acquired this virus in any other way other than contact with his wife. Close contacts with confirmed cases are the way that this virus is spread.
And are you waiting for other test
Are
results
any
to
of
come
them
back?
believed to have been in contact
You mentioned
with
that
the original
didn't take
patient?
the L. Can you rule out all public transportation?
So I want to be really careful in terms of providing information that is fully accurate. I can tell you that he has not taken the L, that he has not taken a train, for example. He really gets around primarily in his car. I don't want to overstate while we're continuing to, do some investigations and to follow up. But what I do want to reassure the public about is that anyone who was potentially in close contact with this individual, we will absolutely be following up with and doing all of the standard public health monitoring. And so, the reason I gave those examples is because I know that those are the kinds of questions that folks in Chicago may particularly have. The CDC does consider close contact, really at this point, to be 10 minutes or more of face-to-face contact. And so we'll be looking at settings where there was potentially that close contact, as well as the healthcare workers.
During the Ebola
14
crisis,
other
you all
individuals.
quarantined folks. Can you talk to why it's inappropriate to quarantine the number of folks that you're monitoring now, being that China has taken the extraordinary lengths to shut down regions?
Yeah, so I would say, first of all, we obviously are following CDC guidance on this. At this point, we are still learning a lot about coronavirus. We know that the novel coronavirus is just one in the family of coronaviruses. And there are coronaviruses that are similar to the common cold. And then there are coronaviruses that are more like SARS or more like MERS. And so we're learning really more every day, both about the severity of this disease and about its spread. While that information is coming out, the CDC, I think very appropriately, is making its recommendations based on what we do know about prior coronaviruses. I'll tell you, before being at the Chicago Department of Public Health, I actually worked for the CDC, and I worked on the investigation of Middle East respiratory syndrome, of MERS. I was in Saudi Arabia as part of that team. It is a lot of work to make sure that we are getting, as a country, the absolute best public health information. So I think it is really important. I'm really committed, and the state's really committed to following that best guidance.
So why not isolate the larger number of people?
So certainly at this point, where the belief from CDC is that there is not a significant risk of spread before people develop symptoms, that is not a setting in which we would want to be thinking about overusing resources where that's not necessary. I think obviously as we learn more, it could be possible that we could see that guidance change, but at this point, where we are in terms of what we know about this virus, that would be a very aggressive nature. China has thousands of cases, I'll just remind people, has had many deaths, has had extensive person-to-person transmission, and they're seeing spread in the community potentially. We are not seeing spread in the community. We have one case that is a close contact of our prior confirmed case who had traveled to Wuhan. In that setting, there is not risk to the general community at this time, based on what we know. And so, we'll be following that guidance, but at this point, I think that's where we are.
All right, folks, thank you very much. That's gonna be the last question.
These 14 other individuals, do we have reason to believe
Okay.
any of them
Thank you
are
very much.
responsible